I remember one little girl who came into the emergency room in a public hospital. She was at school in the bathroom, and she was climbing up onto the wall of the stall to look over to tease a friend, and she fell, and her arm was very badly injured. It was cut on the toilet paper dispenser. It was quite gory. The arm tissue was hanging down, bleeding very badly, and her mom was not there. And it was just me and the child and the doctor. The doctor had to irrigate, clean the arm, and I said to her, I want you to look at me, and we're going to go on a walk together to the beach. And I began to ask her to describe what she saw at the beach, what the sand felt like, what the sun looked like, and she very quickly was making eye contact with me. Our faces were very close together, and she was able to talk about this for a long time while the doctor did everything that they needed to do. And she felt no pain, she wasn't frightened, and everything was calm and things went very quickly. The doctors and the nurses needed to focus very quickly on this very dangerous wound. And they could speak kindly to the child, but they had to focus on her body, not on her mind or her emotions. The child life specialist, when they're there in that moment, are totally focused on the child's emotions. Child life specialists are always thinking about the child's development. Not only how are they doing here in the hospital and will they heal, but how are they going to thrive outside of the hospital when they go home. They're thinking about their social connections with their family, their relationships with their family, their siblings at home, their schoolmates, and they're thinking in the long term about how that child will cope if they have to come back to the hospital for more treatment. So it's a very holistic, environmental approach. When we know what the needs of a child at a given age is, we know what interventions help. But even with all that important, concrete knowledge, every child is different. So we can't assume that every 6-year-old is the same or every teenager is the same. And a good child life specialist takes their theory and keeps it in the back of their mind, but is present and really takes the cues from the child and listens as they're making decisions about how to interact and what interventions will be the most practical and useful for that individual child.
No Brasil, a criança não é tão protagonista do seu cuidado como em outros lugares. Muitas vezes, não são poucas, as crianças vêm aqui sem saber o que elas vão fazer. Em alguns consultórios médicos, o pai vai, a mãe vai, e o pediatra pergunta, então, como vai seu filho? E poderia perguntar, oi, tudo bem, qual é o seu nome? Na altura do olho da criança e fala, o que você tem sentido? Desde que a criança entra até que ela saia, ela vai ver esse Child Life sempre em volta dela, sempre falando a verdade e sempre interessado em escutar o que está acontecendo com ela. Então, ela tem alguém em quem confiar. E esse laço de confiança é uma brutal diferença.
Children who know what to expect and know the truth cope better, are less frightened, and heal quicker than children who are in the dark. You don't tell a 6-year-old, well, they're going to tape you in the operating room and cut you open and take out you. Nobody needs to hear that. You talk about the 5 senses. What will the child see, hear, feel, maybe taste? And in this way, you are explaining in a very non-threatening way the things that the child will experience.
A criança tem direito à verdade, porque ela tem capacidade de recorrer aos próprios recursos para ajudar na sua cura.
Play is a way of the child working through scary things. And so when they have had a needle, if they can poke the doll again and again, they're processing their feelings and mastering them and feeling more strong and confident. We also use play to keep children at their developmental place so they don't lose development while they're in the hospital, especially those poor kids who are in the hospital, say, a couple of months.
Você nunca vai dar para a criança um brinquedo que não seja desafiador. E aí a gente vai andando segundo o desenvolvimento e sempre colocando a criança entre o que ela não sabe nada, né, e o que ela sabe demais. Porque se você coloca alguma coisa aqui, fica sem graça. E se você coloca aqui, ela nem imagina como que ela vai resolver, né? E se você coloca uma brincadeira que está entre esses 2 níveis, ela vai junto com você descobrindo como desvendar aquele mistério.
The play doesn't have to be therapeutic with a goal in mind. Just giving the kid an opportunity to be a kid again makes the child feel normal, makes them feel happy, and a happy, normal child who feels good is going to heal again more quickly. There was a study called the Phoenix study some time ago that showed that children that had child life interventions and were prepared needed less pain medication, less anesthesia, quicker recovery and a better recovery from anesthesia, and quicker discharge. Also, there are more recent studies that have focused specifically on MRIs, that with child life intervention, they don't have to use anesthesia, that the child is able to stay still for the procedure, which is both safer, and that it also can be quicker, not to have to go through the administration of the anesthesia and waking up. When you ask who can become a child life specialist, I look at somebody's soul and their heart and their passion and say, can you connect with kids? Can you listen to parents? Do you have the bravery to stand next to a child who is undergoing horrible, painful procedures? Do you have the spiritual fortitude to deal with loss and not fall apart? Do you have psychological health and balance to be strong, to be there for the child and the family? You cannot measure this in an exam, in a test.
Você tem que saber do mundo da criança. Você tem que imaginar que medos que ela pode ter naquele momento e ter essa conversa no olho dela e na altura e no tom de voz e passar confiança.
It is a combination of important scientific standards, but also what I would call the intangibles, who you are as a person.